Good morning, Oklahoma. Welcome to another episode of OSMA Talks. I'm Dr. Bookman, and I appreciate your listening on this Facebook Live. Last week, Governor Stitt announced a new state budget for 2020, and it's been agreed upon and passed in both the House and the Senate. The new agreement includes more than $200 million in new education funding and pay raises for teachers and state employees. The $8.3 billion budget is the largest in state history and includes about $500 million in new state spending. The budget includes an average teacher pay raise of $1,200 per year for 97% of Oklahoma teachers. That's in addition to over $6,000 pay raise last year. The pay raises make Oklahoma teacher salaries competitive in the region and may raise them to the top of this region. There was also another $28 million for higher education and $18 million in new money for technical and career education. Education affects all Oklahomans and thus affects healthcare in Oklahoma. In prior talks, I've stated how important improving education in Oklahoma is to affect our health status. Currently, Oklahoma is in the bottom 5 states in education and is at the top in high school dropouts. Robert Putnam, a leading sociologist, stated that the first step in upward mobility out of poverty is education. It's also known that improved education leads to improved health. In addition to general education funding, the budget allows for almost $63 million for graduate medical education to boost physician training for rural hospitals and $105 million to increase provider rates for physicians, hospitals, and nursing homes. So how does all of this relate to improving our health care? First, the almost $63 million for GME education allows the state to continue to train residents and even possibly expand the number of resident physicians trained in this state. It's a well-known fact that most residents will practice in or around the community they finish doing their training. Doctors are not ready for the practice of medicine after they finish medical school. They'll spend 3 to 7 years of additional training as residents before they're ready and competent to practice medicine without supervision. Oklahoma does not train adequate numbers of residents to fill our healthcare void around the state. While this $63 million does not replace the $110 million that was lost in federal GME funding in 2018, it's a significant step to ease our physician shortage and improve access to care in rural Oklahoma. In addition to the GME money, the new budget allows $105 million to increase provider rates for physicians, hospitals, and nursing homes. Between 2009 and 2018, Oklahoma physician provider rates were cut 13.5%. Last year, a small 2.6% increase helped with funding. This most recent increase will continue to reverse the 9 years of cut. Many people don't realize that most physicians have taken cuts since the mid-1990s in reimbursements. With the added decrease imposed by the state, many physicians left Oklahoma or closed their practice as it was not financially feasible to keep the doors open. Along with the recent state Supreme Court decision to disallow caps on non-economic injury, Oklahoma is again facing a crisis concerning the loss of physicians, especially in rural Oklahoma. In order to improve our health status, we must have the physicians to allow reasonable access to medical care. There's also a provision in the new budget for $29 million to be saved to a new preservation fund to maintain Medicaid provider rates when the federal medical assistant percentage's 3-year rolling average results in a rate decline. Another $10 million will help to decrease the developmental disability services wait list and increase provider rates, and another $4.5 million to increase immunizations throughout the state, with another $10 million of new money for the Smart on Crime program through the Department of Mental Health and Substance Abuse. And while This is the largest budget in state history. Hopefully next year, Oklahoma will have another banner year for state income and further budget increases can occur. How does all this relate to improving our health care in Oklahoma, and does it affect me? Improving our salaries for teachers and investing in education, all aspects of education, should result in a better education system and a better educated population. Studies have shown that a better educated population will result in better health education, better preventive health, and better health outcomes. Funding medical education will hopefully result in more physicians in this state and more primary physicians in our rural communities. This would result in an economic boon for small communities. Studies have shown that a physician in a community is worth $1.9 million in economic benefit to the community. In addition, funding health care and additional physicians would result in allowing rural hospitals to remain open and provide better access for all patients. Hospitals are major employers in Oklahoma and would result in as many as 24,000 jobs in our state. Everyone benefits from an investment in health care. Greater investment in primary care is associated with lower costs, higher patient satisfaction, and fewer hospitalization and emergency room visits. And most importantly, it results in lower mortality. Currently, despite high levels of healthcare spending in the United States, the proportion spent on primary care is insufficient. A shift in resources to support greater access to comprehensive, coordinated primary care is imperative. High-performing healthcare systems are necessary. Underinvestment in primary care gives rise to prevent access and workforce issues. A significant incentive for physicians and other clinicians to choose other areas of specialty undermines primary care. In 2015, Merritt Hawkins designed a new system that measures the state's access to health care. Oklahoma ranks number 50 at the bottom of this ranking. The study suggested that states needed to take more immediate steps to increase the number of physicians they train by funding residency positions. The report also suggested states allow telehealth and use integrated health to expand access. This has been suggested to the governor, and we await his decisions. It was also suggested that states with their Medicaid eligibility by accepting federal money. While I want to congratulate Governor Stittens and Speaker McCall and Senate Pro Tem Treat on a record-breaking budget and addressing critical education issues and health care in this state, I hope this is only the beginning. Addressing increasing Medicaid recipients and getting our federal dollars returned to the state is imperative if we want to improve our health status and become a top 10 state in Oklahoma. I hope that the leaders are listening and will meet with the Oklahoma State Medical Association and myself to continue the momentum that this budget has begun. It's important for Oklahoma and for all Oklahomans. Thank you for listening to this moment, and I hope that you will turn in each week as we do Facebook Live on healthcare.